Oh, okay. So let me do a really quick review for you guys for this exam. First of all, it's 50 multiple choice and 5 true or false. Jumping right into the equipment, you want to make sure that you understand what that different blades fit different handles and so on and so forth. So making sure you understand which scalpel blade is going to accommodate a number 20 blade. Also knowing what a 12 blade is most exclusively used for, as well as what a 11 blade is most often used for. So I think I covered those pretty well in the PowerPoint, but you definitely want to make sure that you're familiar with that. Also know the technical name for a clamp. That's the most commonly called hemostat instead of a clamp, but it is a clamp type instrument. And then know that the type of retractor or even a uterine probe that is able to be bent and modified, and know that that is a malleable type of retractor. Know what Wetlander, O'Connor, O'Sullivan, and Balfour, know what they are examples of. So, those are those self-retaining retractors. Also knowing what type of metal is non-magnetizing so that they can go in the MRI. They're also lightweight and durable, and that's titanium, of course. Know that there is a term for those cut-in lines in the jaws of like hemostats and different tissue forceps. And so those are those serrations. Then which type of suction tip is going to be used in the nasopharynx or in the oropharynx, and it's called either a tonsil or a nasal suction. And that is the Yonker, of course. The joint of the hemostat, of course, where you pass that through, that is going to be the box lock, right? And then know what suture scissor, know which scissors are called suture scissors, that they're the straight and pretty blunt tipped. And then also know the classifications. So if I said, what is an instrument that's like a tweezer, or and also ringed and ratcheted configuration. So know what classification that is. Medical terminology, make sure you know what that term is that's for the cutting device, and that's laid out in the PowerPoint. Endoscopies, so which type of endoscope you're going to see used, like in an example like the renal pelvis, so any natural orifice, so those are going to have to be flexible to get into that renal pelvis. So you would use a uteroscope on that. Also, know what are examples of types of movement of the powered surgical instruments. So whether they are reciprocating, rotating, oscillating, any of those. And so it's about the type of movement. And then knowing when you're talking about microscopes, which part of that is going to, which part of that is the closest to the target tissue. So, if we're looking at proximal or distal, which one is the most proximal to the target tissue? So you're going to have that objective lens really close to that tissue. Then on drapes, of course, which type of the drape is going to be designed to expose the anatomical structures, you know, like the eyes and the ears. Of course, those are going to have those apertures in them. And then a suction tips that's designed, you know, has those multiple rows. You know, we looked at those pictures of those cool types of suction catheters. Also, we're talking about devices that are used by ENTs or neurosurgeons. And then sometimes it can be used by anesthesia, but that's not in a sterile setting, and that is used to find like the location function of certain anatomical structures. So thinking about what a anesthesia provider may use in a non-sterile format compared to how a neurosurgeon would use this device in a sterile situation. And so there we're talking about that nerve stimulator that's going to activate the nerve, let us know what is being engaged. Operating surgical rooms, you know, we have different specialty rooms, and some of them will have like 3 or 4 OR lights. And so knowing which type of those are going to be equipped with multiple overhead OR lights. And of course, that's going to be in something very serious like an open heart surgery or something like that, where visualization is imperative. And then thinking about drapes again, what that opening is, you know, that's placed over that operative site. And of course, that's the fenestration. And then we're talking about sponges. So we've got some really thin compressed sponges, and these are used in very delicate neural structures during neurosurgical type procedures. Of course, those are going to be those little cottonoids and we have some of those in the lab. Talking about dressings. So know the class that would have Minerva jackets, walking, and Spica cast. Know what category that lies in. Drain dressing, cut into which letter shape. If you have a drain tube, know which letter shape that is going to be. Also remember which type of action when we're talking about drains, you know, so there is one that definitely works by passive action. So make sure you know which one of that is. We have tons of those in the lab. There is a type of a syringe that has no calibrations on it. You use this in the lab on a daily basis to fill that up. So thinking about syringes, most of them have those calibrations on there for the measurement marking, but there's one that does not. Know what that is. All right. So there is an action where a cigarette drain removes fluid from the body. Know what type of action that is, how that cigarette drain removes fluid from the body. Is it active, passive, capillary, suction, wicking? You know, which one of those is it? Also know what the types of dilators there are. So just be familiar with some of those names. Also know which type of instrument often has like a tungsten carbide insert, and it also has crosshatch serrations for stabilizing it. Know what the names of the paired parts of the hemostat are, that they're between the box lock and the finger rings. Know what that name is. I know I'm not giving you the answers to all of these, but you're also not here to answer them for me. Which of the following, sorry, I'm reading the question. I'm not going to do that. Okay. What are the types of power sources for surgical powered instruments? So make sure you know how those can be powered, and then know which types of Sponges, so the surgical sponges, which ones are, they're prepackaged in units of 5. And this is really common. Know different examples for different types of surgical dressings. Also know what there are different types of solutions used to facilitate mechanical debridement of a wound. And then make sure that you're familiar with what the thread or tape that is sewn into a countable sponge. What is that term? When you're placing your drapes and you place the first layer of the sterile drapes, what is the shape that you're working to achieve by placing that first layer? Be sure you know that. Also know the type, the variety of draping materials. Also know what is used in a non-sterile way in a surgical case when you're trying to prevent a DVT. So what is going to be used to prevent that? So remember, it's things that you're going to place on the patient prior to the case that's going to be affecting the patient during the entire case to prevent a DVT. And then know what things you're using when you're choosing the type of wound dressing. So, you know, a wound dressing choice is going to be dependent on certain parameters. So make sure that you know what those parameters are as you go to choose that wound dressing. Also knowing the type of surgical supply that does not have an option to be impregnated with iodine or any other kind of antimicrobial agents, because you know there are some that can be impregnated and then others that cannot. Make sure you know what type of catheter is going to be used to drain the kidney, and it's also used it's the cystoscope is also used to help place it in the correct location. Know what those 3 lumens on a Foley catheter are used for. Make sure you know there's 3 functions that those 3-way catheters, those 3 lumens on the 3-way catheter serves. Know which type of urinary catheter requires an incision as well as being anchored to the skin, because there's several different types of catheters and how they're placed and where they're placed. And there's one that requires an incision as well as being anchored to the skin. Know which self-retaining retractor does not have to be attached to the OR table. How many suction systems or units are required to be in an operating room? Make sure you know that minimum number. And on that continuous pneumatic tourniquet that's used, after what length of time should it be allowed to reperfuse before you reinflate the tourniquet? So how long should it be left on before you release the pressure and then reinflate it? Let's talk about Ratex. So when you're using them in a laparotomy procedure, Know how they're used when the peritoneum is open. And then what are some types of drains? Make sure that you know what types of drains are that we talked about in the lecture. And then make sure you understand why chest tubes are attached to a water seal drainage system. So in anticipation, make sure that you know when you pass a suture to the surgeon, what is the next step that you need to be prepared to pass? So what is the next instrument and what is the next step that's going to take place? Make sure you know what syringes can be made of. Make sure you're familiar with a Penrose drain and what it's connected to. Be familiar with 1-layer dressing compared to 3-layer dressings and what they're used for. And review how you're supposed to hand an instrument to the surgeon to provide the most effective use of time. That is all of the material for the exam. So hopefully this will give you a quick review so that you can do the best. And remember, the test is tonight, Tuesday night, due to the holiday on Thursday. So I'll get this posted right now and I'll alert you all quickly. Good luck. See you all on tomorrow night.